I'm Jim McLaughlin, the moderator, and I just have a couple of slides. I couldn't help it as a professor, you just kind of got to put up a few talking points. And then I'm going to turn it over to Kate and Stacy from Cherry Health, and then Russ and Gwen Bolt are going to add their story to this presentation. The idea is to try to have everything wrapped up on our end by in about 50 minutes, allowing enough time for question and answers, and that we wrap it up within the hour period that we promised. But okay with everybody? So here we go. I'm going to try, let's see, share screen. Did this. We practiced. So there we go. All right, can everyone see that?
Yes.
Oh, great. Thank you very much. So, so we're starting out with a lunch and learn, and this is something that we do at Park Church. When we were meeting, we would have one of these lunch and learns once a quarter, about 4 to 5 times a year. And it was really, for me, one of the highlights to work with people to coordinate this kind of event, and where we would learn about different things. And Cherry Health has been a passion of mine for some time because I'm aware of all the great things that they do. And we were going to do this pre-COVID-19, and of course that has consumed us. And so now we're doing it virtually. So I'm honored to do this. Also recognize Camille for helping set all this up for us. I appreciate that very much on the Zoom. So just some brief introductions right here. I wanted to acknowledge and recognize Kate, the Annual Giving and Donor Relations Manager of Cherry Health, is a fundraiser. Her work focuses on the mission with our wider community to gain support and educate advocates for improving community health. Her colleague, Stacy Stevens, is a program manager at Cherry Health. She worked with adult population experiencing life and mental illnesses ranging from mild to moderate to severe. She's been there at 8 years for operational experience working in different health sectors and so on. She's a graduate of Grand Valley State University. Gwen is a retired teacher from Forest Hills Public Schools. She's got a passion and advocacy for mental health, currently serving on the Client Services Committee and is a member of the board for Cherry Health. Russ is a retired engineer, currently mentoring students at the Aviation Academy in Grand Rapids in their Build the Plane program. That's got to be pretty cool to be involved in that. He's has great interest in Cherry Health, especially mental health due to the struggles of their son who passed away on 2018. Just one other point is in this morning's paper, the Grand Rapids Press, there was a nice piece that got lifted from the LA Times on this doctor who's really trying to change the stigma of mental health, recognizing it as a biologic disease. And the takeaways from the article with Dr. Grinker is mental illnesses are a leading cause of disability in the world. 60% of the people with any mental illnesses in the US receive no treatment or counseling. It takes about 1.5 years from the first psychosis to psychiatric care. That is amazing when you look at that statistic. One of the things that got to me is there are two hearts. One is the outside heart that we see, and the other one is the inside heart that the person has and they're dealing with. We must educate ourselves to change the stigma of mental health. And then the closing point in quotes from Dr. Grinker is that culture is at least something we now have the power to understand and to change. And with that, I will stop my screen and I will let Kate take over. Kate, you have the floor.
Thank you, Jim. I really appreciate the time and the opportunity to come and speak with you all this morning. Stacy is co-presenting with me, and I'm very excited to have her join us as well. She's lovely and talented, and it's a privilege to be with you all. I wanted to mention that, yes, Gwen is a board member of Cherry Health, and one of the most interesting things about our board is that over 50% of our board are patients at Cherry Health. And that is really important because it really helps us make the best decisions for our patients. And it's a really unusual fact about how we run and how we serve. So I wanted to point that out. So I'm going to share a little bit about what we do and how we do it. And we're going to be co-presenting, Stacy and I together. But usually when I share about Cherry Health, I share facts, but I also share stories about the work that we do and how we can do it together. So what you'll see is not just who we are and how we are doing it, but you'll hear stories of who we're serving and how their lives have been improved by Cherry Health. The first thing I wanted to make sure that you knew is that we are a little different. We approach health differently, and that means that we approach health as a holistic view of health. Cherry Health is different. We look at a person's health and take into account what's called the social determinants of health. And that means there's all kinds of factors that surround you as a patient that affect your health. And what does that look like for the way that we care for you? The other thing about Cherry Health is that we are affordable, accessible care. You often have heard in the United States of America, some of the challenges that we encounter are that healthcare is unaffordable. And Cherry Health is actually one of those places that it is affordable, and that's intentional. Cherry Health has been established as what's called a federally qualified health center. And that means that we create a healthcare home for our patients. We coordinate our care, and actually that kind of coordinated care changes everything. It saves money for the national healthcare system. We coordinate our care with everything under one roof so that patients that are encountering a physical appointment can also actually encounter a counseling appointment under the same roof, or you can encounter a vision appointment within the same day or a dental appointment within the same day. Our pharmacies are right on site so that if you're prescribed something at your medical visit, you won't have to come back or find another place where you can get that help. And it also helps with warm handoffs. If you're in a visit with your dental service provider and your heart rate starts to go up because you're a little nervous about the care you're about to receive, your primary care doctor can come and check in with you about that, or your therapist could come and work on a breathing exercise with you to help you calm down. It's amazing the way that we can care for people with this holistic approach. Let me see if I can get to the next slide here. My computer just freaked out on me. This is where I'm going to turn it over to Stacy.
Don't let the computer freak out. So welcome. Thank you all for allowing me to join you as a co-presenter. But a lot of people don't know that we serve a lot of people. A lot of people know that we're the building on Cherry Health Hill kind of thing. And we're so much more than that. We serve so many more people, and we have so many more physical locations, including also right now doing a lot of telehealth appointments as well. But we, on a typical year, serve 70,000 patients. I mean, that's a lot if you can imagine. I mean, if you think about our community, we serve 70,000. And then 96% of those that we serve are impoverished. So they fall below that poverty line. And so as Kate was saying earlier, that we provide that access and care that people can afford. So 96%, that's a huge number. And then even with that, we are able to provide such quality care that our patients have given us a 94% satisfaction rate. That's really hard to get. That's really hard. And this number seems to just continue to increase year after year. And even during a pandemic where care kind of changed a little bit for a lot of people due to telehealth, but still to have that 94% satisfaction rate is amazing. People still feel that we are providing them the care that they want, that they deserve, and they are getting that holistic care where they are getting that care from all ends, whether it is the medical component, the mental health component, dental, vision, family care pharmacy. And we do that in 6 counties, not just here in Kent County. We are bigger than that. And we make sure that in all 6 counties, including this county, that we are providing care for every single person that walks through our door. It's important for that, providing care for everyone at any time. And so in all of these different counties, all of these different physical locations that we have, one of our main things is providing that primary care. And so we serve our rural areas and our rural health centers, making sure that we are reaching out to those that are near and far. We provide family medicine as well as adult medicine. So if you are just an adult with no kids, no reason for family medicine, you can just be seen an adult. If you have a family, we have family medicine where you can be seen for your care as well as your children's care. We have just specifically a peds department where our adolescents to our babies are seen in our pediatrics department. We also have a maternal and infant health program. Maternal rates are so high, and one of our programs, the maternal and infant health program, is significant in decreasing those mortality rates. And these programs have provided a lot of information and a lot of guidance to brand new parents. And then we are also in the schools. A lot of people don't realize that we are also providing medical care to our adolescents, to our high school aged and younger kids that may not necessarily have the ability to get to a physical location and can be seen in our school systems.
I wanted to tell you a quick story about that cute little baby that's up in the corner there. That's Killian. Killian was one of the babies that was born during the pandemic. And Killian's mom was helped by our maternal infant health program. And, you know, a lot of things changed for a lot of people during COVID-19. And the thing that didn't change is the fact that our moms in the maternal infant health program had an entire complete team caring for them. We have what's called a care team at Cherry Health, where the nurse, the doctor, the psychiatrist, the counselor, the pharmacist all work together on a patient's health and coordinate that care to make sure that their emphasis is on the patient. And that's even happening in our maternal infant health program. We typically would go to someone's house and visit with you. We would have a lactation consultant come to your home. During the pandemic, we were the team that helped comfort women as the world changed on them and as they had to understand how they were going to give life a chance inside of a pandemic. And so these babies were born. We had over 500 babies born over the last year as part of the maternal infant health program. And what Stacy was saying is so true. Over the last decade, our maternal infant health program has reduced infant mortality rate and maternal mortality rate, especially in families of color, by 50%, which is incredible. So these programs are reducing those health disparities that we know our families are encountering. That you know, recently the United States government has come forward and said that racism is a health pandemic, and we are trying to encounter that with honesty and intentionality as part of Cherry Health.
The pharmacy. The pharmacy is such a huge part to Cherry Health. One of the main things is there aren't very many places that you can go to right after a doctor's appointment and get your medication right then and there. All of our patients can see their medical provider, see their psych provider, go to the dental office, and literally be prescribed a medication and go across the hall or down the stairs and go to the pharmacy and get their medication right then and there. And the turnaround to get those medications is so fast. So our pharmacy is integrated within our team, within our the care that we provide, because we also have a shared electronic health record that allows us to get that medication down to the pharmacy so quickly And then our pharmacy staff is able to get that filled because they know that our patients are right there and they are relying on them to be able to get their medications quickly. So we have our pharmacy located in some of our sites. And then we also mail medications as well. I know a lot of people know about mail order, but we also have our own form of that as well, where we can mail out our medications. And then we also have this program called the 340B program. This program is amazing. It makes medications affordable. And I can tell you that the patients that I see, some of their medications, they might be on multiple medications. And if you can imagine trying to have all these different medications from different providers and you're impoverished, how do you afford those medications? The 340B program makes it available for individuals to be able to purchase their medications, afford those medications. And also it helps with some of those really, really expensive medications. I can tell you specifically in mental health, psychotropic medications are extremely expensive. And the 340B program really helps to make that affordable and accessible to our patients at Cherry Health.
I want to tell you a quick story about Pearlie, who's in this picture. She is a school bus driver, which means that she is on contract and makes too much money to qualify for Medicaid. And she has to purchase all of her healthcare a la carte. She is a contract driver, so she doesn't have access to traditional healthcare through her employer. Pearlie is on several medications, one for hypertension, one for her diabetes, and a few other occasional medications. If she was going to approach that care from anywhere else, she would pay hundreds of dollars for her medications. And because of the 340B program, she is able to get those medications for around $15 a month. If there's anybody you want to have their blood pressure medication so that their heart can be healthy, it's Pearlie. She's the school bus driver. We want to make sure she's healthy and well for those students so that she can be there for them and she can enjoy her work. I want to tell you a little bit about our dental services. Dental is one of those things that we don't often think about when we're thinking about holistic healthcare. And many people are dramatically uninsured when it comes to dental health and oral health. I myself went without dental coverage for about 7 years. I had good health insurance, but dental coverage wasn't part of it. And I just didn't go see a dentist during that time because I couldn't afford it. Now imagine if you had a place like Cherry Health in 7 or 6 different counties now, where you could go and access your oral health, your dentist appointment for as low as $20. That's what most of our patients would pay for a visit, for any visit at any time, if they are uninsured or underinsured. We are also the only place that you could go to for emergency services. If someone is having a terrible toothache, you can't go to an emergency room and access a dentist if you don't have insurance. We are the emergency services for the entire area. We also have school programs where our dentists and hygienists go around to schools and set up shop inside a school library or a school music room for a day so that students can have access to those appointments without having to miss an entire day of school. You don't often think about how families have to encounter transportation difficulties. If you're taking a bus to get to school and your parents don't have a car, imagine having to take a day off of school to take your bus to your dentist, 2 or 3 hours just round trip trying to get to where you need to go. Now we can keep kids in school if we come to them. And then a lot of those kids are accessing their programs that way. Honestly, it's one of our largest needs. It's one of our biggest services, and we can't even meet all the need that's out there. I want to tell you a little bit about Owen, who's in that picture. Owen was one of our patients in what's called substance use disorder. He was utilizing drugs to deal with some of his pain, and And he was going through treatment for substance use disorder. He was addicted to opiates, and his teeth had been ravaged by years and years of the drug use. And because he was in recovery, there was a certain way that he had to approach the care for his teeth. He could not use traditional pain medications because he had been addicted to them in the past. Well, our teams work with Owen to make sure that they can care for his teeth without that kind of medication. And that's the way that we're approaching holistic care. We're not saying this is how you have to be treated. This is saying, who are you and how can we treat you better? Now Owen has an amazing smile and feels much more confident. When I had him send me this picture, he was still in the middle of it and he wasn't ready to smile for the camera in a traditional way. So he's going to send me a new one soon. We also take that same approach with vision. I want to say that a lot of times our eyes are our vision into our health and our window into our health. We have what's one of the most rare things in the National Health Center system. We are one of only 3% of health centers in the nation that have access to vision as part of your services. It was started completely by philanthropy. We had a doctor, Dr. Mark Sheldon, who grew up in that poverty cycle. And when he grew up and was working at Grand Rapids Ophthalmology, he knew that there were enough people out there that needed care. And so he came over to Cherry Street and set up shop and started providing services for free with a flashlight and an eye chart. It's those kinds of people that change the world. Now we have 3 full service sites, one in Greenville, one in Wyoming, and one at our Heart of the City Health Center. And we also have school programs, and we're going all over and doing the same thing where we set up shop in the back of a library and do fully dilated eye exams for students free. And then we also get them glasses. I want to share a little story about Quanice, who you see there. Quanice was in 5th grade when she finally got access to a fully dilated eye exam. She had been through health department checks before for her eyes, but never got a full access to an eye appointment until 5th grade. I love this story because her teacher was noticing that she kept sitting in the front of the class, but as Quanice grew taller and taller, that became a problem in the class. And her teacher recognized that the same thing had happened to him when he was a young person. And he said, I need to get you into Cherry Health's vision clinic. So when the next time they came to school, he sent her down to that service, and sure enough, she needed glasses. And now she can sit wherever she wants in the classroom. And also she can learn and read better. And we're finding that when we offer those services to young people, their behavioral challenges change. Trying to remember who was going to take this slide, Stacy. Is this me? This is me. Yeah. We also have many specialty fields. And some of the things that we do that not a lot of people know about is we do research. We do health research, mostly in the mental health field, where we're able to access a really unique population and do a lot of projects to fully understand the implications of medications or interventions to make the mental health environment for folks much better. Recently, we have been doing a lot of research actually on the COVID-19 vaccines and working with patients and our research team to do trials of vaccines. And we have been one of the largest sites in the entire United States to provide a diverse population to those studies. We also offer health insurance assistance. So if someone comes into a health center and is uninsured or underinsured, we have an entire team of navigators that help them work through that. We also have a community reentry program for returning citizens, and those returning citizens are coming out of the federal prison system, and we work with those folks to reintroduce them into their families and communities by providing them all the healthcare that they need, therapy, and we also have guided employment for those folks. So we have a therapist that works with people to get them back into their families, and we have an employment coach that helps them get into a career, and so that they have the holistic approach to their new lives that they have been seeking. We also have substance use disorder programs where we can help our communities deal with the opioid epidemic. The opioid epidemic did not go away during this pandemic. If anything, it was heightened. And we are seeing new patients every single day, and we're helping people encounter what's called medicated assisted treatment, where we can take care of their withdrawal symptoms alongside accessible behavioral therapy. And then Stacy, I want you to talk a little bit about our Clubhouse programs, if you would.
Sure. So Clubhouse is a program for individuals that have mental illness, and it allows them to have those skills or create skills, whether they are social skills, physical skills. And the big thing about this program is it's run by all of their program residents. So all of the business sides of the Clubhouse are run by all of their participants. All of the food that is served and made is done by all of the participants. Oh my gosh, a lot of the day-to-day tasks that are done to keep the program running are all completed by all of the participants. This is their program. So how it is run and how people participate in that program is done by them. We have staff that helps to guide all of the participants through it, but it's a place for them, created for them by them. And the nice thing about it is when a lot of these individuals have isolation, or they don't have those supports at home, Clubhouse becomes that support. It becomes an area where they can build those social skills. It's an area where they can build those employment skills. So they may want to work at a restaurant, but they may want to learn skills in serving food or making food. There may be skills in washing dishes. There may be skills in the business side of learning the computer and learning spreadsheets and Word, and even just the camaraderie that comes along with that, the friendships that they build. Clubhouse is an amazing program for that, and it's also a program where people feel they have a sense of belonging. They are someone with a mental illness, and they know that someone else there also is living life with a mental illness too, and they won't feel judged being there. So Clubhouse has also kind of helped to remove some of those stigma that we see in the world, because they are with people who are just like them, trying to do exactly what everyone else does in the world when it comes to socializing and having those work programs. And then, so as introduced before, I am program manager, and I am program manager for our behavioral health, our mental health programs. And so what I do on that side is a lot of the operational pieces and making sure that we are taking care of all of our consumers the best way that we possibly can, and making sure that we have what we need to have in order to provide that care. So with Cherry Health, we have the program Maple Health Home, which serves individuals that have severe and persistent mental illness. It's an integrated program where, when I say integrated, we provide the mental health services as well as the physical health services. And it has been shown that it's hard to take care of your physical health if you can't get your mental health taken care of first. Can you imagine being told that, you have just been diagnosed with diabetes? You don't know what that means. You don't know how to take care of that, but you don't even know how to take care of yourself because your mental illness is so prevalent. And you're thinking and ruminating all day on, the anxiety that you have, or the depression that you're experiencing on a mild side, or maybe you have schizophrenia or bipolar disorder, and you aren't quite sure how to even deal with that. And even your family isn't quite sure how to deal with that mental illness. So we use an integrated system where we make sure that we are taking care of that mental health, but then we can take care of the physical health as well. And we very much so understand that your health care is not just physical health care, it is your mental and your physical, plus everything else that is a part of that as well and affected by that. So we have Maple Health Home, which it serves those that have a severe and persistent mental illness. We also have our counseling center that provides counseling services where you can receive therapy, you can receive psychiatry, you can receive groups types of interactions where you can meet with other people that are dealing with the same thing and utilizing the same, what we call modalities, different practices to work through your mental health. And then we also have things like intensive outpatient services where you may need to be seen a little more frequently than once a week or once a month kind of thing. And these individuals are seen on a more regular basis. And that's not something that usually lasts for a long time, but it's something to get you introduced into therapy and help you with your mental journey. And then we also have other services that are within the schools as well, where we provide mental health or behavioral health services there as well, where as Kate spoke earlier, instead of having someone come out of school and have to spend hours on end just to get to a session and then get back to school, we're able to provide that service for an hour in the day, and then they can go back to their education. So we also provide that in the school so we can reach our youth, especially because there are so many instances like social determinants of health that affect us as children that we don't even realize. And the services that we've provided prior to COVID-19, a lot of it was in-person services. We saw a lot of patients on site. We would go see them in homes and in the community. And since COVID-19 happened, that has changed our services pretty drastically. The majority of all of our services went telehealth or audio, meaning just over the phone. And then the ability to see patients in their homes and in the community also suffered as well. Different places in the community were closed and we can't meet people, at the Burger King that person is able to get to. We weren't able to go into the homes right away. And if we did, we had to be in PPE, personal protective equipment. And if you see that, it can be scary looking. You have a gown, you have a mask, you have goggles, you have gloves, and you're completely protected. And that can look very scary and intimidating to someone who especially has a severe and persistent mental illness. And that can cause a lot of conspiracy thinking and paranoia around that. So changed our services in that way as well. A lot of our services, patients weren't coming on site. They were afraid to come on site with the pandemic. And so a lot of our services went telehealth. But with our population, a lot of them don't have the access to a smartphone like the rest of us did or do. And so a lot of our services ended up being just over the phone. And there's so much that you can miss, unfortunately, over the phone. You can't see how they're dressed. You can't see how they're interacting. You can't see, how are they walking? Have things changed? And you can't see that over the phone. And over the phone, it's really easy to say, "Oh, I'm doing just fine," and really you're not, kind of thing. And there's some of those cues that we see in person that we can't get just over the phone. So our services have definitely changed that way. And even with our patients, we have seen a lot of isolation during the pandemic. People not being able to visit other people, their support systems, their friends, their family, loved ones. Isolation has been huge. And being able to take transportation. A lot of our patients use the public transportation system, and that was limited. Can you imagine needing to get to an appointment and your appointment's at 11 o'clock and you leave at 9 o'clock to get on the bus, and the bus rolls around and it's full because there's capacity limits. And now you have to sit there and wait for the next bus, and that bus comes, and guess what? It's full again. Because of capacity limits. And so just being able to utilize transportation, whether it was for appointments or to get to a store for food. I mean, a lot of this was taking them a very long time. So COVID-19 has presented a lot of changes in our patients, but the big one has been the isolation piece. And therefore, in a lot of our patients, despite our outreach, despite us trying to have those conversations, getting people into the office, isolation has been huge. So for our patients that we serve, the big thing for us in trying to reach them is the transportation, as I was just speaking of. A lot of them, they take that public transportation or they rely on someone in their family, and trying to rely on someone that is also working, and them needing to coordinate their schedule to get time off to take you to an appointment is difficult. Plus all of the issues with trying to get transportation, public transportation for appointments. That's a huge barrier for our consumers. Another one is the technology piece. A lot of us are able to do telehealth. We have a cell phone. We're able to FaceTime and have those appointments over our phones. But a lot of our patients, if they have the ability to have a smartphone, they do not have the minutes to talk on that phone or the data. And sometimes if they're able to get the data, they have to get into a public space in order to get that Wi-Fi to utilize data. But a lot of them don't have it. I can tell you that there are many times that we have an appointment with a patient and it's over the phone. It's just completely audio. And we go to call them and we can't get through to them because they don't have any minutes on their phone because they can't afford it. There are several people through this pandemic that lost their jobs, or they are considered essential workers, and they are put in the face of COVID and having to see multiple people and then getting sick. So technology has been a huge barrier for us trying to get in touch with our consumers as well. So COVID-19 has presented a lot, but those are two things that if we could break those barriers, that would be very beneficial. But the number one thing overall that I could mention every day and every minute of the day is the stigma around mental illness. So many people are just not educated about mental illness. And as James had said earlier, it is a biological disease. It is something that it's not just like something we just woke up and decided we were going to do today. This is an imbalance in your brain, and you don't get to choose if it works or not. So the stigma that is behind mental illness is huge, and understanding that someone that is dealing with anxiety, dealing with depression, dealing with schizophrenia, bipolar, it's not their fault. And they are just people like the rest of us with circumstances just like everyone else and experiences, and they should be able to just be a part of life and enjoy life just like the rest of us.
Thank you, Stacy. It's my honor now to introduce Gwen and Russ, and they're going to share a little bit about their experience through Cherry Health and the changes that it presented in their life.
Hi, I'm Gwen. My dear husband Russ is here for moral support because this is rather difficult for me to do, but I want to honor our son and I want to honor Cherry Health. We were blessed to have Matthew for 37 years. God took him home a little over 2 years ago on July 5 of 2018, and we miss him immensely. I trust God's perfect timing and am becoming more and more convinced that one purpose of Matthew's relatively short life is to bring about an awareness of mental illness and to make known options for help. This is where Cherry Health comes into the picture as a key player. Matthew had a normal, happy childhood. Living in the country, he would spend hours and hours roaming the woods and playing with Legos and playing with his brother Jeff and having sleepovers with friends. Matthew's teen years became more tumultuous, but we just assumed we were dealing with some typical fluctuations of hormonal change. He did okay in high school, but it was not the best time for him. A bright spot for Matt was always his art. Matthew enrolled in Grand Rapids Community College. Photography courses were his favorite. He later enrolled in Grand Valley State University as an art major and moved into an apartment for his junior year of college. What had shown itself in moments and clues before became more apparent at this time. We would come home to find Matthew's car in the garage because he thought that cars with foreign licenses were following him. We knew then that something wasn't right. His illness had become more evident. College was no longer an option. One summer, Matt walked to a payphone. He called the police because he said someone was messing with his mind. It is here that he began his treatment for his illness at Cherry Health. Matthew, now in his early 20s, was diagnosed with schizophrenia. His Cherry Health case manager, James Ruark, helped educate Matthew and us with respect to this devastating diagnosis. As Matthew's illness progressed, he could no longer hold a traditional job. So James helped Matthew start a micro enterprise business. He also helped Matt apply for affordable housing, get food assistance, and he even visited Matthew at his apartment. James encouraged Matthew to enter his photography in Art of Shining Through, which is a juried art exhibition where several pieces of Matt's photography were juried. This gave Matt a sense of pride and reminders of his value to our society. Due to funding cuts, Matt lost his case manager, so I stepped in to fill that role. I would take Matt to his appointments at Cherry Health. The difference in care was immediately evident. Receptionists were not just friendly, they were helpful in an array of situations, always extending the extra mile to solve problems and to help us find resources. They took a personal interest in us. Social workers offered Matthew counseling, and they treated us and his extended family with compassion. They would respond to my phone calls and questions, that is, as much as HIPAA confidentiality rules would allow. The nurse that gave Matthew injections to stabilize his illness even came to his wake. Matthew's doctor at Cherry Health was and is second to none. He's a specialist in schizophrenia, and he's nationally known for his research. He was always available by phone, and Matthew liked him. Now, you have to understand that Matthew absolutely hated his psychiatrist. He thought they were useless and that they just prescribed placebos. But with Cherry Health and Dr. Atchis, it was different. Following his first visit, Matt exclaimed, "Mom, I really like my doctor, and I think he's only 4 years older than me." Dr. Atchis helped Matt nearly quit smoking. He also addressed medication side effects with comprehensive care, assuring that Matt's dignity was at the center of his health care. In addition to psychiatric care, Matt was able to receive his primary medical care at Cherry Health. Their model of integrated wraparound care results in outstanding success in wellness. As a bonus, the Heart of the City Health Center is housed in a beautiful light-filled building. It has covered parking beneath the building, and it is located on a main bus line. These amenities help clients to make medical and mental health care more desirable and easier to access. Clients experience greater success because they are treated with skill, with dignity, and with compassion. This form of integrated care gave us our Matthew back again. I'm so thankful for and so proud of Cherry Health.
So for about 6 years, from age 22 to 28, Matthew struggled with debilitating paranoia, delusions, and anger towards those who loved him most, his family, mom and dad, brother, grandparents, those closest to him who loved him most. And Cherry Health was a crucial part of a team that gave us back our son. And I've talked about this in many cases, but it was the one event in his life and in my life that really opened my eyes to the disease, how it can be treated and changed, and the positive effects that come from it. This gentle and kind son that we knew in his younger years was restored to us in the last 10 years of his life. Cherry Health gave us hope in the dark years and delivered on a promise of a better future in the last years. So I've got another opportunity here to thank them, to thank Cherry Health, but I was thinking while this was all going on, there's many people here on this meeting that have helped just as well. And I thank you also. Many of you helped our son over the years, in these dark years, and helped us. But all the people at Cherry Health, when I would walk in that facility and I'd see how clean it was and how orderly and how wonderful the people that work there would be to help you. They're a team, and they made a difference in Matthew's life, and they made a difference in our lives, and I'm sure many others. I mean, they were instrumental in teaching us how to deal with this mental illness that Matthew had, both as interactions with him, but also how to deal with it when it came time to call the police to have him picked up and have him put in the hospital. They were the ones that taught us how to do that. You don't normally learn that sort of thing except in cases where you have a family member going through this. So Gwen and I thank you, Cherry Health, and so many people here. But going forward, we promise again to continue to support Cherry Health however we can, financially, volunteering, spreading the word, making sure that those around us know the good things Cherry Health has done, can do, and is striving to do. And we ask that all of you listening here, please do what you can to help Cherry Health prosper and give hope to those that enter its doors. Thanks.
And we don't do this work alone. We have an amazing community that has come around us and said that the way that we can treat each other can change. And the reason why we were invited here is because I know Park is considering how they can help and how they can become advocates for this kind of health. And I have a couple more slides, but we're going to forget those because I'm sure you all have questions about what we're encountering and how you can help. So I'd like to open it up to some questions. You can either put them in a chat, or you could just raise your hand or unmute yourself if you have any questions about what's next for Cherry Health, or what we're encountering. Stacy is very knowledgeable on all things behavioral health, mental health, and she'll be able to answer a lot of those questions as well.
Jim McLaughlin, Stacy, I got just a quick question. I was really taken with the personal protective equipment ensemble and approaching someone who may have a mental health issue, and that protocol, how you were able to make that work, because it's I'm in the public health field. I know all about PPE and full gowns and doffing and donning masks and so on. How did you make that work? Because as you know, we hit a milestone a couple of days ago. 3 million people have passed because of COVID-19, and over 560,000 in our own country alone have passed. Yet we have this issue between those that don't wear a mask and wearing masks and so on. We have our rights, and yet, there's this public health issue. How did you make that work? Because you really laid out a very good visual of your challenges with this.
Yeah, so one of the things that we have done with our patients is we had conversations with them first, letting them know kind of what to expect, so that then when they got to either the physical building itself, or if we were meeting with them, that they already knew what to expect. It's really difficult if you don't have that conversation first. And then you show up in all of this PPE, this personal protective equipment. So our case managers and therapists, if they were meeting with someone, or if someone is coming on site, we lay it out completely for them. And that could be the case manager or therapist telling them, or it could be the front desk staff, the patient registration specialist. When we have those conversations with them, we let them know, hey, if you're coming to the building for your appointment, you're going to be stopped by a screener at the door. They're going to ask you some questions, and you'll see people gowned up. You'll see people with masks on, with goggles on, with gloves on. And then we also, remind them too that we're a health center and we want to protect all people. And so we are all wearing masks, and we're all wearing masks at all times. And we ask that all of our patients do the same thing. And if they take it off or slide it down or whatever it may be, we ask them repeatedly to put it back up. And the wonderful thing is, I have not come into an encounter yet where any of our patients were like, oh no, I don't want to, or I'm not going to. They have all been very respectful and have put it back up. And it might be back down a couple minutes later and you just remind them again, and they put it back up. But it's crucial to have those conversations and put out those expectations so no one is caught off guard. And that's whether they're coming to the facility or we're meeting them in the community or in their home.
What are some of the concerns that you all are hearing in your circles around mental health and behavioral health? What are you hearing? Stories of people who are having difficulty accessing their care? I know we all have different circles. One of the things that a lot of people haven't thought of during this pandemic is that as people are transitioning off of traditional healthcare, employer-based healthcare, we've added about 12,000 new patients over the past year at Cherry Health. That's a lot. We aren't usually adding that many per year. Usually it would be around 1,000. So we have about 12,000 new patients over the 6 counties that we serve.
I think, thank you so much for a great presentation, Kate. Wonderful job. Stacy, outstanding insights that you never really think about, like running out of minutes on a phone. You can't make your call to make appointments, and transportation issues and so on. Just amazing stuff. And Russ and Gwen, we love you and we thank you very much. That was probably very hard for you. So thank you. Camille, thank you for hosting us. We appreciate Park Church and all you do. And let's grow this union of understanding and support Cherry Health wherever we can. Thank you very, very much and have a great continuance of your day.